Welcome to Organized, a webinar series on organizational capacity building. I'm your host, Althea Hart with Emory University Campus Coordinating Center. Emory University Campus Coordinating Center created this monthly webinar series to share with a broader audience of Southern nonprofit professionals some key information they may be missing. These webinars were designed for the busy nonprofit professional on the go to get a quick training and resources to help their organization function at the highest level. These webinars were designed to give people a look at what other trainings we have available at Compass. Each webinar will highlight one or more of the 8 core areas of our capacity building trainings. For more one-on-one trainings, we invite you to request a training at our website. Today's webinar, Advocacy and Policy, the Building Blocks for the Future, will highlight a few strategies and tools that all CBOs should not only consider for their organization, but also when advocating for policy change in their city and state government. I'm sure many of you know that if it weren't for many social action groups in the 1980s and early 1990s that protested, wrote letters, and advocated for themselves and people living with HIV, that we wouldn't have any antiretroviral treatment to suppress the virus today. With the HIV work having such strong policy change roots, it is only fitting to celebrate the accomplishments in policy and the champions that fought for those needed changes. Today, we will hear from one of those champions today who knows just how money works, Mr. Devin Barrington-Ward. Devin, I turn it over to you.
Yes, and I know policy advocacy, and I also know how money works, so thank you. Good morning, everyone. Thank you all for joining this important webinar. Thanks to the folks at Emory Compass for hosting this as well. The Black Futurists Group is really appreciative of the opportunity. My staff helped me get ready for this presentation today, and so this is a labor of love from all of the folks at the Black Futurists Group. In addition, I think that it's important today, considering the death of Congressman Elijah Cummings, that we all reflect on how we engage within our government and political systems, particularly as it pertains to ending the HIV epidemic, which we know impacts so many communities that have oftentimes been harmed and ignored by systems of government that oftentimes perpetuate systems of oppression. My name is Devin Barrington-Ward. I have a background and worked in and around politics for about 14 years now. Got my first start working with Stacey Abrams when I was 16 years old when she first ran for office. And from there, I had a wealth of opportunities to serve as a campaign manager, a chief of staff, a former communications director at the DC City Council and with Whitman Walker Health, along with the National Coalition of STD Directors. But where my interest really in terms of how advocacy and policy impacts HIV is because I'm a young Black queer man who's seen so many of my friends serial convert and have also seen some of the people that I care about the most transition due to complications from AIDS. And so I understand that my contribution to the work is helping cultivate more policy and advocacy efforts within the community. A little bit about the Black Futurists Group. We are an organization that really houses policy, advocacy, and political strategy, and intersecting it with innovation and imagination, along with Black culture, to build Black futures. We do this out of a belief that Black life is valuable, precious, and worth protecting. We understand that Black empowerment is a necessary element in the larger struggle for collective human rights among all people. And we work with those standing at the intersections of varying cultural, ethnic, and gender identities across diverse communities to build, preserve, improve, and advance Black futures. The advancement of Black futures is the advancement of the future. And I think it's really important that we frame that for folks so that you all know how we do our approach to the work. Next slide. So this quotation is from Frederick Douglass, and I think it really grounds what policy and advocacy is all about. Those who profess to favor freedom and yet depreciate agitation are men, women, people who want crops without the plowing up of the ground. They want rain without thunder and lightning. They want the ocean without the awful roar of its many waters. The struggle may be a moral one, it may be a physical one, or it may be both moral and physical, but it must be a struggle. And if policy and advocacy is nothing else, it is a struggle. It is oftentimes a struggle between those in power and those seeking equity. It is often a struggle between those who are oppressing and those who are being oppressed. And it is also a struggle between the will of communities who are marginalized to band together so that they can shift the systems that impact our lives and the people that we serve. Next slide. And just very quickly on the Frederick Douglass quote, I quoted it directly. Frederick Douglass, at the time when he wrote this, just reflects where we are. And so while the quote did mention men, I think that he would agree at this point where we are this time that that should be a much more expansive inclusion of folks. So defining public policy and advocacy. Public policy can be generally defined as a system of laws, regulatory measures, legislation, ordinances, and funding priorities about a given topic promulgated by a government entity, its representatives, or its citizens. Individuals and groups often attempt to shape and create public policy through education, awareness, lobbying, and the mobilization of interest groups. These activities are all considered forms of advocacy, which can be done by an individual or group seeking to influence decisions within government, economic, and social systems. Advocacy includes public policy, laws, and budgets by using facts, not fake news, y'all, relationship building, the media, and messages to inform government officials and the public. Lobbying is a form of advocacy where a direct approach is made to legislators on a specific issue about a specific piece of legislation or bill. I think it's important that we make the distinction between advocacy and lobbying, and also it's important that folks know that because lobbying is just one form of advocacy. Advocacy can be so expansive. You can do advocacy on your job, advocating for better workplace policies. You can do advocacy in your grocery store, making sure that they have fresh fruits and vegetables. But as we talk about it from the political system, oftentimes lobbying is one of the effective forms of advocacy as pertains to doing public policy. Now our next slide is going to just break down some misconceptions. Next slide. So one misconception is that that public policy and advocacy isn't necessarily important to the capacity of CBOs, but I'm here to say that it is. CBOs and ASOs and other service providers play vital roles in developing and implementing public policy that builds healthy futures. As service providers, you all witness and respond to the impact of both the negative and both the negative and positive public policies that impact marginalized people, the folks in the communities that we are part of and the people that we are serving. Whether they are patrons of an arts program or they receive HIV services or they're residents of a homeless shelter, all of these individuals are receiving services from community-based organizations, ASOs, and other service providers. And you all are the institutions that have the closest knowledge to the real problems that are impacting the communities that we serve. And as service providers, you all can be a really great bridge between policymakers, government agencies, and the constituents that you're serving. Effective advocacy builds on your capacity to achieve the greatest good for the greatest number of people and the communities you serve by creating a legislative and regulatory environment for the most optimal health outcomes. And so one of the reasons why we hear a lot about lobbying is industries hire lobbyists a lot. Industries like the automotive industry or the oil industry, the financial markets, they do this because they want to shape and bend policy, laws, legislation, regulatory rules so that it favors favorable outcomes in their industry so they can make more money, that they can hire people. And as a social justice advocate, we also have to recognize that sometimes that comes at the expense of our folks. And so we need to be able to apply those same principles for the greater good, which is, and for this particular conversation, the end of the HIV epidemic. So imagine what it would look like for you to live in a community or a state where politically, legislatively, regulatory-wise, you are in an environment where you are set up to succeed. Next slide. Next slide. Yes, so lobbying and back one. Yes, lobbying and nonprofits. So lobbying and advocacy are not interchangeable. Generally speaking, advocacy encompasses many different activities designed to promote a cause or idea. Lobbying refers to specific activities intended to influence legislation, and there are rules governing these activities. Nonprofits, whether they are 501c3s or 501c4s, are allowed to engage in lobbying activities, although the rules are stricter for 501c3 organizations. There is a limit on the amount a 501c4 can spend on lobbying activities. However, federal law prohibits 501c3 organizations from spending a substantial part of their time or budget on lobbying. So, unless your organization is involved in a substantial amount of lobbying, you are unlikely to come close to the financial limits. So, there are so many organizations that do engage in lobbying. Many of them are public health organizations or related in healthcare. And so there's a misconception oftentimes in the HIV space that organizations are not allowed to lobby, but we don't see that misconception in spaces around cancer prevention, heart disease, and some of the other health epidemics that are impacting our communities. In addition to that, what is considered substantial? So for an ASO, for example, an AIDS service organization like Aid Atlanta or a larger one like AHF does engage in a level of lobbying. However, the amount that they do is not considered to be substantial. So they never get close to the financial limits laid out by the federal government in terms of what lobbying is allowed to be done by nonprofit organizations. So if the majority of your organization's work is to providing direct care to communities, it's very unlikely that you will be engaging in any amount of lobbying that would be considered substantial, that would raise any attention or get you in any trouble with any government entities. Next slide. So at the Black Futurists Group, we have an approach to public policy and advocacy. And we believe that one, effective public policy and advocacy needs to be strategic. So it needs to be outlined under some SMART goals, and we'll get to that soon. It also should be intersectional. So advocacy and public policy shouldn't just speak to one aspect of a person's life, or one aspect to a community that is being impacted by negative health outcomes, but it should also be intersectional and connect the dots between all of the other areas and all of the other lapses that we are seeing in community, and how that piece of policy and that advocacy effort can be more intersectional to encompass those things. It should also be collaborative. None of the work that we do at the Black Futurists Group is not done in the spirit of collaboration, because we recognize, one, we can't do it all by ourselves, and two, we also recognize that we can't effectively speak to all of the experiences that need to be represented in effective public policy and advocacy without being collaborative. In addition to that, we're grounded in equity and a vision of liberation. So equity, oftentimes people confuse equity with liberation. Equity is the place that gets us closer to liberation, and I think that is a vision that we are still curating, but it should be articulated through your public policy and advocacy efforts. Also, we recognize that actively listening, learning, sharing, and building community is a necessary approach towards public policy and advocacy. Public policy and advocacy should be bold and transformative. It should also be trauma-informed. So trauma-informed public policy and advocacy is essentially understanding that the various traumas that communities and individuals experience can oftentimes be the best place to look for how we incorporate public policy that seeks to heal communities after so many years of oppression, after so many years of disenfranchisement. In addition to that, it should also build power. It should build power for the communities that are being impacted, for people who are living with HIV as it pertains to ending the HIV epidemic. How are we building power amongst this community so that it can be used to continue the preservation of health outcomes? In addition, our toolbox we use with all of our policy and advocacy efforts, we use coalition building, we engage in political strategy, we engage in media engagement, public policy development, legislative advocacy, and lobbying. And like today, we provide training, technical assistance, and capacity building assistance as well. Next slide. So, building the future through public policy and advocacy. First, you need to set a goal. So it's important that when you are going through the process of developing public policy and advocacy priorities, that you understand what the goal is and that your goal is also realistic and winnable. So the goal is different from the vision. The vision should be something that is overarching, something that is inspiring, something that is large. So the vision to end HIV is a very large vision. The vision to end the prison mass industrial complex is a very large vision. The vision to end white supremacy is a very large vision. However, in order for your goals to be, your advocacy to be successful, you need to have some goals that are more immediate and a little bit smaller that take steps towards accomplishing that larger vision. Advocacy is a marathon, it's not a race. So when you are evaluating your goals, you want to make sure that they're smart. So you want to make sure that they're specific. So how is your policy and advocacy goal specific? Ending HIV is not specific. What is specific within that goal is making sure that communities, low-income communities of color, have access to care that is free or at no cost. That is something that is specific. Another specific example could be developing a PrEP drug assistance program in your state or in your city. That is another specific. Something that is measurable. So in public policy and advocacy, it is oftentimes difficult to measure, to be measurable in your goal at first. But here's some things you may want to take into consideration. One example of a measurable goal for public policy and advocacy is how many elected officials are you trying to communicate with? How many people in community are you trying to empower to feel strong enough to come down to the Capitol and advocate on these things? Those are measurable goals. So keep some of those things in mind as you're laying out your goals. It should also be actionable. So how can people take whatever your goal is and do something with it? And not just you, because again, advocacy and public policy should be done in a spirit of collaboration. So how can not just your organization, but how can the other entities and communities that are in your atmosphere take action on this? And is it also realistic? Can it happen? So for example, saying we're going to end HIV next year is not necessarily realistic, but saying that we can increase the number of people who have access to PrEP at no cost is something that is realistic. And it should also be time bound. So what is the time frame, timeline that is going to set for? Because as it pertains with public policy and advocacy, many of these things operate in a season or a season, whether or not this is a good time to do something. Current events impact public policy and advocacy goals. So you want to recognize that when you're setting out your SMART goals for your advocacy and public policy efforts. Next slide. And also, you want to create the message, and excuse the typo. So without a well thought out and intentional message around the subject of advocacy campaigns and efforts, no one will know what you want. The message should take into account the respective audience you want to educate, engage, or influence. It should be a message that your supporters and your targets can easily understand. Your message should not only inspire people's thought, but move people to act as well, which means it should be easy to share. When you're evaluating your advocacy message, you want to ask yourself, is the message credible? So one that means, particularly in the day and age of fake news, wild accusations being thrown around on cable news every other moment, tweets coming out from certain people who shall not be named. We want to make sure that what we are offering through our advocacy messages are credible. We also want to make sure that it's clear and that it's concise, so that it's not convoluted, that people can't clearly understand what it is that you're trying to communicate. Excuse me. It should also connect with people. So in connecting with people, how does it connect with people's values, the experiences that they've had? How does your message connect with people who are living with HIV? How does it connect with people who are formerly incarcerated, LGBTQ, trans communities? Those are the people who oftentimes are not thought about when we are curating messages around public policy and advocacy. And we need to be more intentional about centering those folks and communities when we are putting together our public policy and advocacy priorities. It should also communicate your values. It should also provide a demand. It should provide a clear target, and it should move people to act. Next slide. You should also be recruiting a team. You cannot do these public policy efforts by yourself. Whether it's organizing a advocacy day at City Hall or at your state capitol, or if it's trying to do a press conference with the media, or setting up meetings with elected officials to have some more intimate conversations. All of these things take time, and it means that you are going to need some help. In addition to that, public policy and advocacy efforts that are not developed with a team run the risk of not appealing to a broad base of stakeholders and decision makers, or the public at large, which is also a decision-making body. So you want to make sure that you have a team so you can, bounce ideas off of one another and make sure that you aren't just channeling and developing these messages, these policy priorities and advocacy priorities in a vacuum. So early on, you want to determine the needs of your effort. So what will you actually need? What type of skill sets, what type of people, connections, networks, and relationships you will need to strengthen your advocacy efforts. And here are some skills that you may want to think about as it pertains to advocacy and policy efforts. Next slide. And then you also want to determine a timeline. You want to be specific with your time, but not so specific, because as you can see in our political system, current events change so rapidly. And so that means it also oftentimes impacts our public policy and advocacy efforts. But I'm here to say it's going to be okay. Relax, breathe. It's natural. It's all a part of the process. What will help is you determine benchmarks and mapping out what goals you want to reach, what checkpoints you want to reach along the way to make sure you're fulfilling your goal. So for example, if you were to decide I want to develop a PrEP drug assistance program in my state, that is a goal that is a part of a larger vision to end the HIV epidemic. But within that goal, you're going to have some checkpoints along the way to make sure you're fulfilling your goal. So one checkpoint might be developing a coalition of all of the other organizations in the area that I know would be willing to support this, or to see if they would be willing to support this and what ideas they have to advance this. Then you would want to, at that point from that coalition, you may want another checkpoint along the way. They say, okay, well, we need to set up meetings with elected officials along with the coalition. Then we need to do a press conference. Then we need to do a training for community. Then we need to do a provider's day. All of those things will be checkpoints along the way of fulfilling your larger goal. When you're mapping out your timeline, mapping out a timeline will help make measuring progress much simpler. If you reach a point where you haven't hit one of your benchmark mini goals, take a step back and evaluate. Here are some things that you want to ask yourself as you are determining the timeline. Is it realistic? Does it leave room for unforeseen events or changing shifts in our political system? Can your coalition members commit? Can your coalition members commit? That's a big one. A lot of this work is going to be volunteer-based. Some of it will be staff-based as well, but you all are doing a lot of work. already. But this is important work and can enhance your work that you are currently doing. So I very much press upon you to make investments in this area, but also make sure that you can commit to the time. And that may mean bringing in a larger coalition. And also, is it the season for my issue? So by season, are the people in your city, your state talking about this particular issue? And sometimes if it's not the season for your issue, how do you create the seasons for your issue? And then also, how does your timeline impact, how is it impacted by fundraising? Some of these things, for example, like AIDS Watch is not free in Washington, D.C. I'm sure AIDS United would very much agree with that. And so what resources are going to be needed for your public policy and advocacy efforts? But for direct service providers, when you all look at your budgets and if you were to compare it to some of your program budgets that provide direct services, and you were to compare it to the cost of public policy and advocacy efforts, you would see that it would be very, very much less expensive to engage in that body of work just for the things that are needed to make it happen. Next slide. And then you want to figure out also what are going to be some of your advocacy activities. So how will you share your campaign or your advocacy idea or your public policy idea and what is the message going to be, and how are you going to convey it to the decision makers, the influencers, supporters, and the public? So will it be email campaigns? Will it be earned media, like getting on the news or the radio and talking to folks that way? Will it be door-to-door canvassing, paid media opportunities? You need to establish what your budget can afford. Advocacy can be done for free, but sometimes it does take money to take things to the next level. Here are some ways that you can communicate your advocacy ideas. So advocacy days at the Capitol or City Hall are really great. They're modeled after AIDS Watch in Washington, D.C., and you can most certainly do that within your local government to have some sort of health responsibility. Earned media, so TV, print, radio, blogs. Of course, there's paid commercials, social media, physical and online petitions, rallies, demonstrations, and direct action organizing, which, of course, harkens back to the days of the ACT UP movement and the work that was eventually birthed out of that created Treatment Action Group. Email campaigns, phone banking, and, of course, introducing legislation. Next slide. And so here are some other additional considerations you want to have as you're exploring engaging in public policy and advocacy. You want to understand the basics. There was a statistic that I found quite disturbing, that there was a group of adults, they were quizzed on basic civics, and 83% of them failed. So it's really important that you understand the basics. So the three branches of government, those three branches of government are the executive branch, the legislative branch, and the judicial branch. And that is not only represented at a federal level, but oftentimes you find those branches of government at the state level, at the city, and at the county level. So you also want to understand your structure of your local government, which means also understanding who your elected officials are. I cannot tell you how many times I go into a room and folks are not aware of who their school board members are, their state representatives, their county commissioners, but the school board member is who determines whether or not there's going to be sexual health policy within the local school systems, or if there's going to be testing allowed in the schools. The state representatives determine, whether or not your state is going to be expanding to Medicaid, which we know can greatly increase our efforts in terms of being able to end the epidemic. So you want to know who those folks are that are in those seats. You also want to understand the legislative process. So how a bill becomes a law. We don't have time to get into that today. That is a part of one of our more expansive trainings where we get into more specifics about your specific community. But as a general, I think Schoolhouse Rock, the video, the bill on Capitol Hill, on YouTube, it's always a great way to freshen up your understanding of how a bill becomes a law. You want to select and research your target. So oftentimes in public policy and advocacy efforts as it pertains to the government, who is your target? Now, target doesn't necessarily mean something negative, but who is the focus of your advocacy and public policy efforts? Is it a body of individuals? Is it the mayor? Is it the governor? Is it, whoever it may be in your state or jurisdiction that impacts HIV care? You want to figure out who is your target. So who represents you? You want to understand what their voting record is. You want to establish if you have any common ground, if any. You also want to understand their interests, and you want to determine who and what influences them. Power mapping. So power mapping is an exercise that we also do in an extended training where we go through the atmosphere of your local community. So who are the people who are in the decision-making seats, and what are the different maps and points of connection between them, and how are the folks involved in the advocacy and policy efforts connected to them as a means of being able to influence them so that we can get the public policy and advocacy wins that we set out for. And then you also want to research the environment in the season. So what is the status of your issue at the legislature? Is this a good year? So a lot of times, many legislatures have not done anything on HIV. So sometimes you have to make it a good year. Other times we've seen some states that have made it a bad year. One thing I will say as an important note, California, whether or not you agree with the decision to allow PrEP over the counter. Okay, I think I've lost the.
Give us just a moment, folks, while we try to reconnect really quickly.
Hello. Am I back? Can folks hear me?
Yes, Devin, we can hear you.
Awesome. Okay, so what I was saying was we want to research the environment in the season. What is the status of your issue at the legislature, and is this a good year? So one of the things that's interesting is with California's recent decision to allow PrEP to be obtained over the counter, it will be a conversation starter in many of your states. I know there's some not all 100% agreement with that decision. However, what it does provide is an opening where other states are going to be looking at ways, particularly around PrEP policy, that can get PrEP into the hands of people more easily who need it. Next slide. And now we have questions.
Awesome. So if anyone, thank you so much, Devin, for sharing. If anyone has a question, please feel free to drop it in the Dropbox, or if you'd like to, we welcome you to unmute yourself as well if you'd like to ask Devin a question over the phone. And we are open to some questions.
Hello, Devin. We have one question.
Yes.
Okay, great. So, Devin, this question comes from one of our listeners, and the question is, you mentioned that it's a season for our issue. Is there anything that we should be aware of what's coming up right now that we may need to make our organizations aware of as far as issues related as we get closer to election year for in 2020?
Yes. So I think a lot of it is national, but all politics is local. So it will depend a lot on what's happening in your local community. But more on a national level, there are some conversations, particularly around the president's ETE plan that is going to be continuing to roll out this year and next year. We'll start seeing some of whether or not what the administration has set out to do has actually happened. But also we still have, and many states are still considering the expansion of Medicaid. We also, with the decision that California made, around allowing PrEP to be obtained over the counter, that is also going to be a point of conversation where folks are going to be talking about. But I think the end of the epidemic plan, which was something that the administration has touted, has gotten a lot more more traditionally conservative legislators to engage in the issue. So it is an avenue to have some deeper dialogue with conservatives on the issue of HIV. I see we also have a question from Sandra Vincent. What are some specific ways in which to engage in advocacy void of lobbying, especially in federally funded bodies? So I'm going to answer your question in two ways. One, there's nothing that prevents any nonprofit from engaging in lobbying, particularly if it's self-defense lobbying. So if there is a piece of legislation that is going to drastically impact the way that your ability to survive as an organization, you are entitled to engage in lobbying work. In addition to that, as stated before, there are times where we do need to get specific on a specific piece of legislation. And if you are not doing, as an executive director, if your job is to run the organization and you're at the Capitol, 5 hours out of a work week, that's not a substantial part of your time or responsibility that is being set aside by lobbying. So I think you also kind of want to look at it like that as well. But outside of lobbying and federally and federal spaces or any government space, there is education-based advocacy. So when you are speaking with a legislator more generally about PrEP policy, being that PrEP policy is good, that PrEP drug assistance programs work, that folks need more access to services, at the point where it only becomes lobbying when you mention a specific bill. You can even provide model legislation from another state, and that is not lobbying because it is a model, it's a sample, it's not the actual bill that you're giving to someone. And so it only becomes lobbying when you specifically tell a legislator you should vote for this specific bill. When you say you should support policies that increase the access of PrEP to everyone, that is not lobbying. It only becomes lobbying when you get into the specifics of that bill within that specific government body. So again, you could even offer sample legislation. So let's say, for example, you wanted to talk to your legislator in the state that you're in about the bill that California introduced. You could go and download that bill offline, bring it with your conversation and say, this is what California is doing, but that is not lobbying. All you are doing is educating and informing. Lobbying only happens when you get into the specifics of a specific bill and you ask a legislator to vote for a specific bill with a bill number. You're welcome.
Great, that was really good. We got another question that came into us. This is from a smaller grassroots organization. How is a small grassroots organization located in the rural South, where most of the funds go to some of the larger metropolitan centers, begin to have a conversation with not only their local officials for seeking funding, but also with some of their state officials on how that resources can be spread throughout their state?
So I'm not sure where this person is located, but I know that's a conversation that happens a lot throughout the South, particularly I know here in Georgia, our capital is located in Atlanta, but we have a lot of legislators who come to the capital from rural areas of the state. And there's been a lot of conversation around rural versus urban, that Atlanta gets a lot of the resources and the rest of Georgia does not. And there's definitely some truth to that. So with that being said, it oftentimes is an entry point for people to come in and say, hey, we need to receive some more funding. There needs to be some more parity in the resources that rural communities have. An example of where that has happened, and while I didn't agree with the entirety of it, the way HOPA funding formularities were changed specifically because rural communities requested to have more parity in the way that housing opportunities for people living with HIV funding was provided in their communities. And that it was generally the previous formulary had favored larger, more urban communities, even though we're seeing the bulk of the new cases, with the exception of some cities in the South, we're seeing the bulk of the new cases in rural communities that are not located in cities, so throughout the country. So with that being said, I think that one, sometimes it is very difficult to get your volunteers and your folks down to the Capitol, but these folks represent and live in your communities, particularly the state and local folks. So there's nothing that stops you from organizing a tour. Like if you are a service provider in an area, have you invited your senator or the delegates of local elected officials to come and tour your space? Have you, have you invited an elected official to one of the support group meetings? Of course, with the permission of, folks at the support group, but to hear directly from people who are living with HIV. Those are some ways, some initial ways to have some of those conversations. And that doesn't require a whole lot of resources or a drive to wherever your capital is. You can literally bring them to you. And so a lot of that time is, again, figuring out in that, meeting of the minds of the folks you work with in the rural communities, who is connected with the elected officials that are in your area, whether maybe somebody goes to school with their daughter, you go to church with them, whatever the connections or the entry points, it doesn't matter. What matters is who's connected and who can make the ask and who can be the most effective person at making the ask for that elected official or elected officials to start engaging in those conversations back home with the people that are in the rural communities they represent. I hope that answers your question.
Great, thank you. Actually, so part of that actually sparked another question that we see here from someone that's coming out of Clayton County here in Georgia. Noticing that in the epidemic and the counties that surrounded that I'll make sure I'm saying this right, that in the epidemic program through Trump and his administration, we're targeting specific counties and specific states, although many counties within the Atlanta metropolitan area were selected. Clayton County was not one of them. We have a participant that's just curious on how Clayton County can possibly partner some of their organizations there, or even sway maybe some of the administration and the Department of HHS to provide services, or even including Clayton County within that.
So I think a couple of things. One, there's an AIDS watch. I think it was a big mistake for Clayton County to be left off. But I do think that there are still some entry points as far as making sure that Clayton County gets the resources that it deserves. One, I think many of the elected officials in Clayton County are unaware that they were looked over for this and the epidemic money. We learned that DeKalb County received the first batch of money almost as a surprise, although there's still some debate about that. But to give them the benefit of the doubt, they characterized that the initial funding that they received from the pilot money for the End the Epidemic program was rushed. And so while it caught them off surprise, I'm sure that folks who were not included didn't even know that this was a thing. And so I think, one, it's talking to members of the Clayton County delegation, the state Senate and the state House, to inform them that this what this ETE program is, and educate them on why it's really a missed opportunity that they were not included in the ETE plan. I also think that same conversation should be had with the local county commission as well, and the school board, because it's important that the electeds in the area also become champions and start asking questions of their colleagues on why they were left out of the process as well. And so I think those are some initial ways to start having those dialogues and elevating the conversation to the area where it needs to go. So that there can be more folks pushing for Clayton County to be a part of the regional plan to end the epidemic.
Great, thank you. And I see we have another question from one of the chat bots. Any advice to cope with conflicting ideologies when advocating or lobbying? For example, anti-trans legislation in federal grounds might be more evident. What can be some unforeseen issues arising when need to be aware of? We need to be aware of. Apologies.
So yes, so I think I understand the nature of the question, which is, for example, there's some legislation that may have really good things in it, but there are also pieces of it that either adherently ignores communities that we know are essential to ending the epidemic, or worse, not just ignores, but actually seeks harm. And so how do you balance those efforts when trying to move legislation, I think is what the question is, and if the person who asked the question could confirm that that is what they would like for me to answer, then I'll move forward. But assuming that that is the case, I think one, it is setting up your values very early on with the people that you are lobbying or doing advocacy work with. You should not just jump in advocacy. You should not just jump in advocacy and policy efforts with folks and you have no understanding of what their political ideologies are. You have no understanding of the values that they bring to the table. What are their non-negotiables? Those are how community activists and grassroots efforts that are not well thought out get pulled apart and picked apart by elected officials, and you see no movement. And so because the moment where they can see division, they either lose interest or they'll take the opportunity of that division to sow even more division and conflict within the ranks. So I think it's important very early on, before you start doing setting up meetings, before you start, talking about legislation, is really just having okay, how are we gonna get in bed together? Like, what are you into? What am I into? What's your non-negotiables? What's your safe word? What's my safe word? We just need to make sure that we're on the same page, or that we're at least that we're in the same book. So that we can engage in advocacy that honors the dignity of all people who are involved and the people that we know need to be represented in our advocacy efforts tenfold. So I think it's really important to set up those expectations and those parameters very early on. The other thing is, I think it's important to know, everything can't be non-negotiable. So while I agree that, for example, legislation, I don't care how good it is, it can't be good legislation if it's anti-trans. And I know sometimes there will be debates between, more community led organizations and organizations that are led by directly impacted people, and institutions that are serving those larger institutions that are serving those communities, that are oftentimes willing to overlook some ugly aspects of legislation in their claim for the greater good. I'm not one of those folks. I don't believe that any legislation, for example, any plan that seeks to end the epidemic, but it doesn't center trans people, is not a good plan. And so I think that we have to set those expectations up very early.
Great, thank you.
And I hope that answers your question.
Great, thank you, Devin. We have a few more minutes if there's any more questions out there. But quickly before we get at least a couple more questions, I wanted to make sure I share with you all. In the chat box, I have attached a survey link for everyone. If you all would not mind completing a brief survey for us before you go, to let us know how you all enjoyed this webinar, so that we may continue to provide you all with more trainings that you are looking for, and just maybe some more topics to include. We definitely want to thank Mr. Devin Barrington-Ward for being with us this afternoon and sharing with us all of his expertise, all of his knowledge.
Not rushing the day.
And we have a few more moments for just a couple more questions before we close on out. So I'll open the floor once again for at least one or two more questions if there are any more that are lingering out there.
Well, if there are no more questions, I would like to leave folks again bringing now one of our new ancestors into the room, Congressman, the Chairman Elijah Cummings. He said in one of the last hearings that he had with Cohen that when we are in heaven, I'm paraphrasing, but when we are in heaven and we are dancing with the angels, we will be asked what we did in 2019. And I hope that through this conversation today, that you'll be able to say that I got involved, that I agitated, that I built the future, and that I built community, because I do truly believe, like Congressman Cummings does, that this is God's work. So thank you all for tuning into this discussion. I believe, Darion, this will be available pre-recorded. So if you're folks that you feel like need this information but weren't able to be here today, feel free to share it once they make it available. And you can also connect with the Black Futurists Group in a multiple of ways. Black Futurist with an S, blackfuturistsgroup.com. We can also be found on social media under that same name as well. And you can email us via the website. Thank you so much and enjoy the rest of the day.
Thank you, Devin, so much. And, you know, we echo the sentiments, and we certainly want to lift up Representative Cummings for all of his work that he's done for us. Thank you once again, everyone, for participating and asking questions. If you all would like to request a training and would like to see this video, because this has been recorded, please make sure you visit our website at www.gileadcompass.com. And tune in next month on Thursday, November 21st, for another webinar on how to support your staff, providing wellness and assistance with healthy work-life balance. Until next time, you all, have a great day and be well.